The accolade coincides with the meticulous research and treatment of the London patient of HIV. He is the second person in the world to be cured of HIV infection. The patient who recently revealed his identity was cured of HIV following a bone marrow transplant 4 years ago to treat blood cancer. He received stem cells from a donor, which Professor Gupta says prevents HIV from taking hold in the body. Gupta says that the patient did not show any signs of HIV in the blood after 30 months without taking his antiretroviral drugs. This technique was duplicated and was the first to cure another case dubbed the Berlin patient of HIV in 2009.
The advances that have been in only 2 individuals worldwide, and that's because of the fact that we need to use chemotherapy followed by transplantation of new blood cells into the person with HIV to remove the old cells and replace them. This is a very dangerous procedure, and it was only done because these 2 individuals that are recorded, the latter one being our London patient, these individuals both had life-threatening blood cancers. One was a leukemia and the other one was a lymphoma. Both of these diseases were going to lead to death of the individual unless something was done. And that's why a transplant was considered and undertaken using tissues or cells from a donor who had a specific mutation or a genetic variation, which meant that donor had a mutation in a critical gene or protein that HIV needs to infect cells. And so HIV was not able to infect the cells of the donor, and therefore when those donor cells were implanted into our patients, these patients became resistant to HIV.
His partnership with the Africa Health Research Institute in KwaZulu-Natal looks at understanding the genetic makeup of individuals to drug-resistant HIV. The institute has been conducting a long-term study at one of the global epicenters of tuberculosis and HIV and AIDS pandemic. This includes Hlabisa in Umkanya-Kude district on the province's north coast. AHRI is analyzing the data taken from the region's inhabitants and their general healthy history. While a high-risk and expensive transplant is not an appropriate treatment for most people living with HIV, the research offers an important scientific advance and hope for cure strategies.
There are a number of issues to be resolved before it can be used for HIV. One is technological, because we currently cannot change or modify enough cells with our current methods, and we may need to deliver the modification technology inside the patient, which carries its own technological and research questions that haven't been answered yet. And also, of course, the safety aspect, balancing risk versus benefit of these procedures in individuals who alternatively could simply take antiretroviral therapy for the rest of their lives. But also, of course, then there will be some ethical discussions around this as well.
The breakthrough has also yielded results in rapid COVID-19 testing. Professor Gupta with his team of scientists were able to adapt the rapid HIV test for coronavirus antibodies within 90 minutes.
Now, since COVID-19 has hit, we've transferred a lot of our expertise and manpower to some of the urgent questions in COVID-19. For example, early on, we didn't have good diagnostics. The tests were taking too long, and we tested a platform that gives rapid results and can be located near patients. In other words, point-of-care tests for coronavirus. And we found that these were very, very good, and that they could have dramatic impacts on hospital functioning and safety for patients.
Professor Gupta hopes that the research will continue making strides in an effort to find an inclusive cure for HIV and AIDS. His work also includes finding a solution of global access to HIV treatment. Jade Lee Paulser, SABC News, Durban.